Hello students, welcome to Medico Apps Masterclass. In today's lecture, I'll be discussing about use of lasers in surgery. Now, basically, a question on lasers in general surgery is asked as a short note in the exam. Though it's not a very important topic, but it has been asked quite a times in the exam. So let's see what all points you have to write in this answer to score the marks for a short note question. Now, what basically you understand by laser? So laser stands for light amplification by stimulated emission of radiation. That is the full form of radiation. Now, what is exactly laser surgery, or how do we use laser in surgery? So it is a type of surgery that uses special light beams, okay, instead of the instruments for the surgical procedures. Now, if we are not using instruments and we are using a light beam, definitely we will call it as less invasive treatment modality. So I hope you understood that what exactly and how exactly we use these laser lights in surgery. Now, moving ahead from this, we are now going to see some properties about laser. So this laser light, this laser beam which we are discussing about has a specific wavelength. Okay, and what exactly do you understand by the laser? So most of you might have seen laser torches also. Yes, exactly something like that with a high frequency and high radiation and high wavelength. So it is a focused, okay, it is focused narrow beam, and that narrow beam creates a high intensity light. Now, if that focused beam creates a high intensity light, it will be helpful in very precise surgical work or cutting through the tissues, especially the tiny areas where these surgical instruments are difficult to reach. Okay, in those all areas, these laser lights can be focused, and very accurately these can help in cutting or in surgical precise surgical work. So this is the benefit of laser light. Now, moving ahead from here, what is the effect of these laser lights? Now, these laser lights have certain effects on the tissue, the body tissue, and there are certain properties of the laser light which are interconnected with each other. Now, both of them, they are dependent on each other. What mean? That means the body tissues and the laser light properties, they are dependent on each other. So let's first see what are the tissue properties. So the tissue properties include the structure of the body, the water content, how much water content a body tissue has, thermal conductivity, how good a thermal conductor our body is. It's a good thermal conductor. There is heat capacity, the density is high, and its ability, and the body is able to absorb, okay, the body tissues can absorb these lights, or it can even scatter, reflect the emitted energy. So these are the tissue properties. Now coming to the laser properties. So the property includes the power, density, energy content, and the wavelength. It has a wavelength and it has a frequency due to which that narrow focus beam light can enter into our body. Okay, so this is the important laser properties. Now coming to the most commonly used lasers in medicine and surgery, so that includes the carbon dioxide, ND, YAG, or argon lasers are the most commonly used lasers which use in medicine and surgery. So these are the properties and the most commonly used lasers in medicine and surgery. Now moving ahead with the types of lasers. These were the common type. Now we will now discuss about briefly about these types of lasers. So the first laser which we are going to discuss is the carbon dioxide laser. Now these carbon dioxide lasers basically removes very thin layer of tissue from the surface of the skin without removing the deeper layers. That means this carbon dioxide laser can only penetrate very thin layer of tissue from the surface, that is the skin surface, and it cannot penetrate into the deeper layers of the tissue like the subcutaneous tissue and the fat area. Now the second laser here we are going to discuss is the neodymium yttrium-aluminum-garnet, or we call it as ND-YAG lasers. Okay, now these lasers can penetrate deeper into the tissues. This means that these lasers are the lasers which can go inside the deeper tissues and even can help in blood clot. That means it will be helpful in giving a bloodless feel also. The third laser here we are going to discuss is the laser induced interstitial thermotherapy. Now, these kind of lasers are directed to areas between the organ. That means it is now going now it is entering and penetrating more deeper. Okay, so if this is the tumor and if this is an organ present, so these lasers can be directed to areas between those organs near the tumor. And the fourth one which we are discussing here is the argon lasers, which pass only through superficial layers of the tissue such as skin. So the two lasers which can penetrate deeper layers are the NAD-YAG lasers and the laser induced interstitial thermotherapy. And the two lasers which only penetrate the superficial tissues, that are the carbon dioxide lasers and the argon lasers. Now after that, coming to the fifth type is neon lasers, holmium lasers, which are used usually in urology, and last one is the erbium laser. So these are the 7 types, the main 7 types. Even if you write these 7 names in the exam, that will be more than sufficient, because these lasers mostly cover the types of lasers used in medicine and surgery. Now, after the type of lasers, let's see what are the clinical uses of these lasers. So firstly, these lasers are used for lithotripsy. Now here I want to mention that what do you understand by lithotripsy? Lithotripsy means breaking of the stones and breaking it into fragments. Now if these stones are broken into fragments, it can be easily removed from kidney or urinary bladder. So lithotripsy is a procedure where there is fragmentation of urinary and biliary stones. Now how does this fragmentation occur? So this fragmentation occurs due to the sound wave shock, the light shock which is given by laser. Now these lasers usually work on photoacoustical or photomechanical method, which means these are laser induced shock waves. And as you can see in this image, these lasers can give a shock wave in the form of laser, in the form of shocks, and that can break those stones, and those fragments of stones then can easily be removed. Then the second application we are going to discuss is in the oncology. Yes, in the cancer tumor cells, these lasers can be helpful. Now these lasers have photochemical, photomechanical and photothermal effects. Now what do you understand by photochemical or photomechanical? It means photochemical property or a photochemical reaction is a chemical reaction which is initiated by the absorption of light or absorption of energy in the form of light, and that energy in the form of light helps in killing the cancer cells. The other lasers which are used in oncology or in cancer are the laser interstitial thermal therapy, which are preferred in patients who are not ideal candidate for surgery. Okay, now after that, the laser also helps in shrinking the tumor. Now once the tumor is shrink, then we can remove that tumor very easily. Then comes the mucosal ablation by lasers used for the treatment of superficial gastrointestinal cancers, which means it's a minimally invasive procedure that allows the limited removal of small nodules, and that small nodules especially in the superficial gastrointestinal cancers. After that, the next property can be the photodynamic therapy using lasers for specific types of lung cancer lesions. Now photodynamic therapy is basically when we use a drug Okay, now the drug is basically called as photosensitizer. Now, this photodynamic therapy is basically a treatment that uses a drug which is called as photosensitizer, and it uses a type of light energy. Now, when that photosynthesizer is exposed by this light, okay, this specific wavelength of light, they produce a form of oxygen that kills the nearby cells of the cancer. Okay, so this is the property, and this is how we use lasers in the oncology. Then moving to the next application or next uses in the aesthetic and reconstructive surgery. Now you must have heard a lot about the laser therapies which are used these days for anti-aging treatment or in treatment for acne. All these are used in recent times in the medicine. After that, coming to another use, that is the ablation of the conductive pathway. Now in this, a laser balloon catheter in one of the endoscopic ablation system is commonly used for the treatment of atrial fibrillation, and mostly the laser which is used in this atrial fibrillation is the ND-YAG laser. Okay, please do remember, this is the laser which is used here is the ND-YAG laser. After that, moving to some other uses of laser, the other uses can be MRI guided laser induced thermal therapy, which is used for refractory epilepsy. The general surgery also lasers can be used, like for tumor removal or for cataract removal or for breast surgeries or even plastic surgeries. All these are the uses for lasers. Then the refractive eye surgery, this is considered as one of the most important uses of laser. Okay, you must have heard all about the laser surgery of the eye, where the power of your eye reduces. So that is also a major use and an important use of laser. Other than that, in the dental procedures, in order to control the bleeding, or in surgical procedures, even for your dental materials, these lasers are used in shaping that material in the cavity. And lastly, in cranial surgery in the children. So these are all the uses of lasers which we have to mention in the exam. So please do remember all these uses. Now lastly, before winding up, there are certain advantages and disadvantages of these lasers. So the advantages include, it provides bloodless field, which I have already mentioned. It is fast, and small lesions can be easily removed, and it can be completely removed with the help of these lasers. But the disadvantage is that the availability of laser is not everywhere. And the second is that it is cost is a very big factor, because the laser surgeries are usually considered as they are higher in cost. So these are the advantages and disadvantages. So I hope you have understood this short topic on laser in surgery. Thank you.